Today, for the 1 Minute Clinic, I'm going to talk about low-level light therapy. This is all the rage right now, and I actually think there's some data to support it. This is red light and infrared light lamps that we can use at home. It's a little bit of a tricky topic, so this is going to take longer than 1 minute, but I do think that they help. They help with cell regeneration, so they help with healing the skin as well as reversing the signs of aging. And the way it works is that the photons that are leaving the wavelengths, both the red and the infrared wavelength light, is absorbed by your skin cells and actually into the mitochondria, and makes the mitochondria, which are in your skin cells, actually make more ATP, which is the food that makes your skin cells work better, or any cells work better. So you're providing light that's converted to energy, which allows your cells to work better. So they're going to build more collagen, they're going to correct DNA damage, they're going to build extracellular matrix, and they're going to turn over and do these jobs a little bit faster and a little bit better because they have more energy. Now, the tricky thing with this is that you need the right lamp with the right wavelength, the right dose, which is how much energy is deposited into your skin. And that is a function of two things. It's the power of the lamp, or the irradiance, as well as how much time you have the lamp against your face. And there are multiple great options out there. Something that you need to know as a consumer is if it is a really strong light, the treatment time is usually shorter. And if it is a weaker light, the treatment time is longer. And something that seems a little bit not intuitive is that, in fact, for your skin to really use the energy, it can't come at it too fast. So you actually want a lower irradiance, a lower delivery of the light over a longer period of time to get the best possible results. And the lamp that I use, that I'm a big fan of, is Soluma. And the Soluma lamp, actually, it's recommended that you do 2 to 3 treatments a week, and each treatment is 30 minutes long. There's a lot of lights out there and face masks where it's a 3-minute or it's a 10-minute treatment. Those, for the most part, have stronger lights, so they can deliver the dose faster. But with that, the cells get overwhelmed sometimes, and they can't absorb the photons, and you actually don't get the full effect of the treatment. In general, all of them are probably better than doing nothing, unless you have really sensitive skin. If you have really sensitive skin, sometimes the higher powered lamps can dry your skin out and irritate it. Also, the higher powered lamps can also activate your pigment cells or your melanocytes and make you at increased risk of making melasma or brown. So if you have sensitive skin or skin that's prone to making pigment, you want to steer clear of the more powerful lamps. And if you have the time and the money and the interest, I would encourage you to get one of the ones that is either the panel or the mask that can really sit up against your face. I feel like those work much better than the sticks or the handheld devices where you're always moving it, because you can't maintain the treatment, and you want to have sort of uniform treatment over the entire area you're treating. So there's the basics on low-level light therapy. It is not a replacement for the things we do in the dermatology practice, the more aggressive lasering treatments, but what it does do is that if you treat before and after with low-level light, you're actually going to get a better response, you're going to heal faster, and the hope is that you won't need as many of the more aggressive treatments because your skin's going to be correcting itself on its own, and that's the magical thing about skin.